We all should walk more and enjoy how good it feels. Exercise is the most positive thing you can do for your health. I'm Dr. James Hurd, a physician specializing in preventive behavioral medicine and cardiovascular rehabilitation. People take care of type 2 diabetes several ways. About half at least try to do something. Why just half? Some who don't do anything don't know they have a problem. Some deny it's a problem or give up caring about it and hope for the best. Still others simply say they enjoy what caused their diabetes in the first place. Active effort, doing something positive every day, really is easy. Walking is something most of us can do naturally. Using an exercycle and swimming also are pretty easy. More important than how easy it is to exercise, the health benefits of regular exercise are astonishing. Walking a mile a day, 5 days a week, improves health about 30%. Walking 2 miles a day, 5 days a week, cuts risk of disability from poor health in half. People who exercise regularly gain about 5 years of good health over people who don't exercise. Every 1 hour of regular exercise gains 10 hours of good health added to your lifetime. That's a really good deal. As people get older, the amount of their muscle decreases and they get weaker. Bone density gets less, but it's not because of age. It's because of less physical activity. Exercise reverses the changes associated with age. Muscles maintain their mass, and bone holds its density longer. The amount of insulin needed every day depends on the amount of muscle and how much it's used. You should have more muscle than fat. Men should have more than 35% skeletal muscle and less than 25% fat. Women should have more than 30% muscle and less fat. This figure shows the relative requirements for insulin in 4 groups of both men and women combined. The groups range from less than 29% muscle to more than 40%. As the percent muscle increased, requirements for insulin decreased. Each 10% increase in amount of muscle required 11% less insulin. Before beginning a regular exercise program, check with your doctor about possible cardiovascular or musculoskeletal limits. Also, check the level of blood sugar before exercise. Make sure your blood sugar is not too low. Also, don't exercise right after you've injected insulin. If you don't have an exercise program, begin a daily routine of aerobic endurance training. That's walking, running, bicycling, swimming, rope jumping. Exercise you'll eventually be able to do for 20 or 30 minutes without stopping. However much exercise you have been doing, measure your capacity for aerobic exercise now. To do that, walk as fast as you can, as far as you can, for 6 minutes. Use a pedometer on your waist to record the number of steps you've taken. Measure the distance you've walked with a GPS meter on your mobile phone or smart watch. After 6 minutes, just before you stop, measure your heart rate at your wrist with a smartwatch or from your finger over the camera on your mobile phone. Begin or resume your aerobic endurance training program at 50% of the effort exerted during your 6-minute walk test. During each session, continue exercise until you feel you could do as much again without rest. Repeating a 6-minute walk test every 3 or 4 weeks will show you how much improvement you've gained by regular exercise. After you've established a routine aerobic endurance training program on 4 or 5 days each week, add resistance strength training 2 or 3 days each week. That's squats, push-ups, crunches, Begin by testing the maximal effort you can exert without stopping. Measure how many squats, push-ups, or crunches you can do before you absolutely can't do any more. Begin or resume your exercise strength training with exercise session of 5 or 10 repetitions, 3 or 4 times separated by 1-minute rest periods. Each session of squats, push-ups, or crunches should take 15 or 20 minutes. Repeating maximal resistance strength tests every 3 or 4 weeks will show you how much improvement you've gained by regular exercise. Our objective is to maintain the amount and strength of skeletal muscle while reducing weight. Gradual reduction in weight, 1 or 2 pounds per week, makes it less likely to lose muscle weight as well as fat. Increasing amount of protein consumed each day greatly reduces loss of skeletal muscle. Amount of protein consumed should be at least 100 grams every day. For most people, this means doubling the usual amount of protein consumed each day. However, it never happens that amount of muscle gained by exercise balances fat lost by reducing food intake. Recovery from type 2 diabetes always requires reduction in total amount of fat greater than gain in amount of muscle. If you're not reducing weight, you're not losing fat. However, regular exercise greatly decreases the amount of fat that must be lost to recover from type 2 diabetes. If you would like to participate in our type 2 diabetes recovery program, you should sign up in the window following this presentation. After you sign up, you will be asked to register and supply a few points of data concerning date of birth, smoking history, height, weight, blood sugar, and daily injections of insulin. We will call you and establish secure communication links for reporting and reviewing results, starting with fasting blood sugar, basal heart rate, and body weight. Then I will call you to ask about your medical history with type 2 diabetes. Also, we will discuss details of your goals and objectives for recovery from diabetes. In addition, we will set up an action plan for recovery. There is no charge for this service as long as you continue to report on a regular schedule and continue to work towards recovery from diabetes. We are dedicating to helping people recover from type 2 diabetes and maintain good health using telehealth technology.